So I've had a few questions about nurse revalidation lately, and people would like to know some examples of what they put in for the revalidation. So by revalidation, we mean every 3 years, the nurses have to revalidate and prove that they are suitable and eligible to practice within the UK. So the requirement is 450 hours, 900 if you're a nurse or a dual registered person over the last 3 years. So within this section, you're going to write what your job role is, or any job roles that you have within them 3 years, the organisation and the setting. You're going to write the dates that you've worked to and from within each setting and each job role, and the hours that you've logged from each one. You're going to write a brief description of your roles and responsibilities for each job role. So an example of this might be that I've been a staff nurse on an acute medical ward within the NHS Trust. Your dates, January 2023 to December 2025. Hours worked could be 1,250 hours, let's give an example. And then the summary of what you've done and your roles and responsibilities. You've provided holistic care for the acutely unwell patients, you've done medication administration, you've done patient assessments, risk assessments, discharge planning, you might have mentored students and had an involvement in safety planning, safety huddles and multidisciplinary team meetings. The next section is going to be your CPD, which is your continuous professional development. Your requirements for this is 35 hours of continuous professional development. 20 of these have to be participatory. So what you need to include in this section is your title of the course or any training that you've done. You need to put the date and the duration, so how many hours you did of that training, the type, whether it's participatory, so whether you've taken part within doing that or whether it's just been a bit of online training that you've also attended. You need to then write where you attended it, whether it's course, face-to-face, online, etc. An example of this that I would have used is, for example, I've been on a course with sepsis recognition and management, so I did this in a classroom face-to-face for 3 hours. The reflection that I could write about this would be it improved my ability to recognise the signs and symptoms and the early red flags of sepsis. I've then applied this knowledge within my practice by escalating deteriorating patients using the NEWS2 score promptly, and then I've got a further assessment from the doctors and a plan has been put in place of what to do with this patient. Section 3 of the revalidation would be your practice related feedback. Now this requires at least 5 pieces. You can put more in, you probably will get more over the 5 years, but at least 5 pieces. So what to include in this? So your source, you could get these reflective pieces from, your feedback could be from patients, relatives, carers, it could be your one-to-one with your manager, it could be your yearly PDR or appraisal, you could put things in like that. If you get a thank you card off a patient, you can put that in. Anything really that patients have given some sort of example, or it could be from a student. So my example would be feedback, a patient expressed a gratitude on a clear communication on discharge. So they said that I'd done really well on this discharge, it was totally thorough. So my reflection on that could be that it reinforced the importance of simple explanations to patients, checking the patient's understanding of what to do with the wounds, what to do with the dressings when they go home, how to look for signs of infection and sepsis, where to go and what to do if they do see any of that, and also explaining the take-home medications to them and when to take them. The next section is the written reflective account. So for this, you're going to link each one to the course, whether it's prioritising people, practice effectively, preserving safety or promoting professionalism and trust. So just say how each one links to the code. So you're going to give a brief description of the event or what led up to the event, what happened and how you improved your practice going forward to make sure if it was something that needed improvement, how you improve that in the future. If it was something good, how did you take that forward and make it even better? So it could be, my examples that I have done for one of these was attending an advanced life support course update. So within this, what I've learned, I've improved confidence in leading the resuscitation team and understanding the updated guidelines. My change of practice, now I escalate that bit quicker because I have that main understanding of what to do. I may delegate roles within the team, and then I can review each equipment. I do the resource trolley checks, I know what's in that trolley, what they're used for, I can recognise the signs and symptoms of deteriorating patient, and then I deliver effective care, because that's how I relate it then to the guidelines. Section 5 is a reflective discussion. So this requirement is a reflective discussion with an NMC registered colleague. So that could be another nurse, it could be a manager, a senior member of staff to you. It doesn't have to be, it could just be somebody on the same grade as you. So a staff nurse, if you're a staff nurse, the discussion taking place, and a summary of what that discussion was. So it's relating to how you're doing in general, anything that you need to improve on, talking about your reflective pieces that you've done. I am going to be doing some more posts with examples on different reflective pieces. I'll give you a few, I'll give you 10 or 20 examples of what you could use for your reflective piece, because I know this is one thing that people struggle with the most, and it's just getting them examples. Once you've done it for a few years, you'll be absolutely fine. And I always say that link your reflections to the NMC code of conduct. Keep it concise. Avoid vague phrases like I learned a lot. Say why. Give examples of why you've learned something, and just start it off early. You've got 3 years to do all this. Every single time I do a training or I do some sort of, my mind's gone blank. Sorry. Every single time I do a training course, I will then go on, log onto my computer, bring up my log, and I will just log each one, what I did on that training day, because trying to think back 3 years of what I did, or what did we do on this day, what did we learn, you can't remember. You come home from that training day, that day or the day after, absolutely fine, you can get everything logged. Just drop any comments, I'll help you out, but I am going to be doing some more videos individually on each section of what to do and how to fill it out. and just enjoy nursing.